Hello, everybody. Welcome to a new interview for the ISNCT newsletter. It is a great honor for me to interview Dr. Hiroyuki Nakamura, professor of the Laboratory of Chemistry and Life Science, Tokyo Institute of Technology from Japan. I am Andrea Montihius, and I am conducting this interview with Taiki Morita. We are both members of the ISNCT and the DNCT Communication Task Force Group. Thank you again, Dr. Nakamura, for accepting this interview. First of all, could you please give us a brief introduction about yourself and how did you start working on DNCT?
Okay, so first of all, thank you very much for giving me this opportunity. And I'm Hiroki Nakamura, a professor at the Tokyo Institute of Technology. So I actually started working on BNCT when I was an undergraduate student, so more than 30 years ago. At that time, I joined the Professor Yoshinori Yamamoto's laboratory at Tohoku University. Actually, he presented me with several research projects, and I chose this BNCT project. And at that time, the Professor Mishima has just succeeded in BNCT treatment of melanoma patients using BPA. So I visited his research group at the Kobe University Medical School to learn how to handle cells. And actually, I counted the number of the cell colony in a cell colony assay to evaluate BNCT effect. And my research theme was synthesis of the carbolane-containing nucleotides at the time. And I also succeeded in the synthesis of the carbolane-containing adenosine. And in my PhD course, I was also interested in the synthetic methodologies using a transition metal catalyst. And I also worked on this synthetic research field. So when I got the independent position at the Gakushu University, which is a private university, I noticed that the drug delivery system would be a very important technology for BNCT. So I designed boron lipid and started to establish the liposomal boron delivery system. So currently I'm studying the boron delivery system using serum albumin in our body. So that's all my brief introduction.
So Dr. Nakamura has been working for several years in the development of new boron compounds for BNCT. So which are the general steps or considerations you have to take into account when designing a new boron compound?
Yes, thank you very much. I always think about the therapeutic mechanism of BNCT and focus on the following criteria. So first, boron compound must maintain a boron 10 concentration in tumor tissues to be expected to have an anti-tumor effect during a neutron irradiation. And the uptake rate into the tumor tissues must be higher than that into normal tissues. So therefore, we always consider the tumor-specific accumulation mechanism of boron compound. And the second, the systemic toxicity of the boron compound must be low to ensure safety. So for example, the approval administration protocol of BPA is 500 milligram per kilogram body weight intravenous drip infusion. So can you imagine how much is being injected? So in fact, 30 grams of BPA for patient weighing 60 kilograms. So you know, the IC50 value, which is a concentration to inhibit 50% cell growth of conventional anti-tumor drug, is at a nanomolar level, but BPA is at the millimole level. So, you know, the million times different. So we always consider the cytotoxicity of boron compound when we design them. Yeah.
Okay, next, how far we are from introducing new boron compounds in the clinical field?
Yeah, actually, the two boron compounds, BSH and BPA, were used in clinical study. And in the last decade, BPA has been mainly used not only for melanoma, but also the brain tumor and head and neck cancers worldwide. And as you know, the BPA with accelerator-based BNCT has been approved for treating locally recurred head and neck cancer in Japan. So I think this is a very important event for introducing a new boron compound in the clinical field, because the boron compound used to be evaluated at the researcher level, and there was no authorized criteria for them. But after the approval of BPA, we have learned what are the critical issues for the approval of BNCT agent. So although I cannot say which is good, now what is good, but since so many types of the boron compound has been developed, so I believe that next boron compound or boron agent for clinical use will appear in the not too distant futures. Yes.
A growing modality in precision oncology is the development of theranostics. Could you briefly mention how theranostics is growing in BNCT? Are there any limitations that we have to overcome?
Okay, yeah. I believe that the success of the BPA BNCT was due to the PET imaging of FBPA. So do you know why BPA is now used to treat brain tumor? It is because F18 BPA has been developed and found to accumulate in brain tumors. So the PET imaging of FBPA is very useful to conduct the treatment plan in BNCT. So in this regard, when designing a boron compound, it is essential to consider the development of the theranostics. So as a general consideration, probably the main limitation of the PET imaging is low spatial resolution compared to CT or MRI. And if we focus on the F18 BPA PET imaging, so far, by using the current synthetic protocol, you can synthesize F18 BPA for only 2 patients in a single operation. So therefore, their new preparation protocol is still necessary if FBPA become a conventional PET imaging tool. Yes.
So in Japan, insurance medical care for BNCT has started since 2020. Could you tell us about some examples of treatments?
Yes, as mentioned before, the BPA with accelerator-based BNCT has been approved for treatment recurrent head and neck cancers in our country. And so far, approximately 100 head and neck cancer patients has been treated with BNCT with medical insurance at the 2 hospitals. So one is the Osaka Medical University Kansai BNCT Medical Center. The other one is the Southern Tohoku Hospital. And BNCT with glioblastoma is still in progress of preparing approval document, because they already phase 2 clinical studies already completed. So we are still preparing the approval document. So the approval of the medical insurance treatment of the glioblastoma still take time in our country. And furthermore, meningioma and melanoma and angiosarcoma are in progress for phase 2 clinical trial now in our country. Yes.
So to expand the range of BNCT, what is required for researchers, or what do you expect young researchers to do?
Yes, this is a difficult question, but I think it is required to consider how to improve the quality of BNCT to expand to other diseases, other cancers. So as you know, BNCT is an interdisciplinary treatment. So I would like to advise the researchers, especially for young researchers, to understand this interdisciplinary therapy very well and discuss with many researchers in the different research field other than your expertise to create new idea with them.
Okay, great. Well, really, the last questions, it was related to this. Which kind of advice, which piece of advice you can say to young researchers who want to start exploring BNCT? And I think it is very important.
Okay. Yeah, actually, when I started working on BNCT, it was generally accepted that it would be technically impossible to develop the accelerator for BNCT. So, but you know, we can obtain the neutron from the accelerator now instead of the reactor for BNCT. So therefore, BNCT can be performed in the hospital, even in the big city, such as Tokyo. And the BNCT is being recognized as an open treatment for everyone. So your contribution will change BNCT dramatically. So please remember the reality that many patients are losing their lives every day. And ask yourself, who will develop BNCT? That's you.
Very important advice. Well, thank you very much for your time. It was a great pleasure to talk with you.
Thank you. Thank you very much for this opportunity.